Good evening. Today is March 23rd, 2021, and it is 6:06. As a quorum of the board is in attendance, I would like to call to order the meeting of the Central Health Board of Managers Board Retreat. Do we have anyone here for public communication?
Hi, good evening. We don't have anyone for public communication.
Okay, thank you. Since no one has signed up for public communication, then I will proceed. Members, thank you for joining this evening for this first segment of our board retreat. I say that because, before the pandemic, before pre-COVID-19, we probably would have had a 4 to 6 hour board retreat, maybe on a Saturday at a nice light-filled room with some food and beverages. However, that is not the case now. And I certainly, as I mentioned in an earlier meeting, did not want to subject people to the Zoom overload. So what we're doing is we're taking this retreat in 3 chunks, right? 3 2-hour chunks. Tonight is our first of our 3 parts in a series, a 3-part series board retreat, we'll call it. And my hope is tonight that we can cover some fundamental information and training for board managers in 2 hours or less, perhaps. In April and May, we will follow up with parts 2 and 3 of our series of our retreat. We're planning to bring in a consultant to provide tools and techniques around leading during challenging times, including implicit bias awareness for those parts. And we certainly have survived a tough year, although I know there are many in our community who still are struggling every day, and I'm mindful of that. But we will be continuing in this Zoom world for a while. We will see how things progress as more people are fully vaccinated and what the governor continues to do. But I felt that it was appropriate to go ahead with our board retreat. I certainly didn't want to wait, for instance, till summer. We did wait until now because, of course, we have 2 new board members and we wanted to be able to include and welcome them in our board retreat. So with that, I would like to open up our board retreat, just the first, let's say, 15, 20 minutes with a little question for each of you. We know each other's names, and some of us have known each other for a while, but I have a question that I want to pose to each of the board members that I hope will just allow us a little insight into each other. So you get like 2 minutes with 2 sentences. The prompt or the question is, are you ready? Drum roll. What is your favorite tradition or holiday? I'll go first. And I can tell you my favorite tradition or holiday is Thanksgiving. I love to cook, love to cook. I love having lots of family and friends over. I dream someday of writing cookbooks. That is my favorite family holiday or tradition, to be followed up by Passover and 4th of July, because they're also big family and friends gatherings with lots of food. Okay, so I'm doing just popping as I see you. Cynthia Brinson, your favorite tradition or holiday?
I think my favorite holiday is Valentine's Day because I love to buy little gifts, and that gives me the opportunity to give my staff a little Valentine's gift and happiness.
Wonderful. Okay, the next Cynthia I see here, Cynthia Valadez. Your favorite tradition or holiday? You're on mute.
It's actually the month, the holiday season between Thanksgiving to Christmas. As far as I'm concerned, it's a month of celebration, of reflection, of asking for forgiveness, of making change.
Thank you.
Friends. That's a celebration for me.
Thank you. Maram, I see you next. Favorite tradition or holiday?
Well, actually, mine is coming up. It's surprisingly, it's Ramadan. And even though I'll be caffeine deprived, but it's actually It's the month that we all as a family sit
Right.
down and eat together. And it's just very heartwarming and refreshing. It's a beautiful month despite all the hardships. It is an appreciation of the little things in life. So that's really our favorite tradition and holiday.
Thank you. Charles, favorite tradition or holiday?
Well, since my birthday is always so close to Christmas, I never really got to celebrate it. So my tradition is actually just celebrating everybody else's birthday, including mine, and just remembering them with a text or something like that.
All right. Shannon, your favorite tradition or holiday?
Well, my favorite tradition or holiday, well, I'll say holiday, is between November, it's the month of November. It's my birthday, as Charles has indicated, but it's also Thanksgiving. So I usually take off 2 weeks and travel and visit family, friends, and others throughout the country. So that's my favorite season, holiday, or whatever you want to call it.
Thank you. Julie, your favorite tradition or holiday?
At the end of every year, we nominate a Zuniga of the Year, and I've never won, ever. And so it's really cool. By the end of the year, we start getting phone calls like, you know who I think should be this year? And every year it's kind of the same person. You do not have to be a Zuniga to win. So that is the best news. Zuniga rarely wins this one. I think mostly one of my nephews wins. So he says he wins every year. I don't think it's true, but I love it because everyone's talking about what the big things that happen during the year. So it's not the same as a newsletter or anything. Like we just one time we got a trophy, but, just depends.
Oh.
Thank you. Amit, your favorite tradition or holiday?
I'm a Thanksgiving person, and just to be able to, I guess, say something unique. Traditionally, one thing I like is the Indian tradition, or maybe even the Hindu tradition, but Indian tradition of just the hands together. This namaste, and it means so many things. You don't even have to open your mouth. It just means hello, it means goodbye, it means thanks, it means please, it means sorry, it means I don't want to talk right now. It's fantastic.
Thank you. It reminds me of the word shalom in Hebrew, right? All the different meanings. All right, Pete, your favorite tradition or holiday?
Like everyone else, but Christmas. I mean, Christmas is my favorite time. Just being with family, being with my children, being with my wife, being with my new son-in-law, my new son.
Mm-hmm.
Decorations and getting the house ready for family.
All right. Well, thank you, everyone. Thank you for sharing.
One last thing.
Yes.
So since some of us have mentioned Thanksgiving, I want you to know I was born on Thanksgiving Day.
Really?
My grandfather used to call me la guajolota, which in Spanish means turkey. And my father just wanted to know when I was going to outgrow that. So anyway, there you go.
And Cynthia, I will tell you, one of my best friends growing up, Valerie, was born on Valentine's Day.
Oh, okay.
Yes.
Good.
Yes. Well, thank you all for sharing. I really appreciate that. And it, I think, just helps us to get to know each other, gives us a glimpse, right? So we will turn now, sorry, the dog. My youngest child. Okay. We will turn now to our regular agenda, which is item number 1, receive and discuss a presentation regarding the roles and responsibilities of the Hospital District's Board of Managers under subchapter B of chapter 281, that is where we fall, of the Texas Health and Safety Code and Central Health Bylaws. David Duncan will be presenting.
Good evening, managers. I have got a relatively brief presentation, but unfortunately it's very wordy. Being a lawyer, I have a nasty habit of throwing a lot of words on a page and thinking that's a good PowerPoint. And so I will try not to plow through this thing and bore you to death, but I will be moving rather quickly. If any of you wants to stop me, Manager Motwani and Manager Brinson, you got a shortened version of this in your recent training, your onboarding, sorry. And so some of this is going to sound very familiar. What's not advancing? That's strange. There we go. I'll just give you a quick outline of why I'm doing this and why I do this for the managers every year. Did it last year. Basically, to give you just an inventory of everything that's behind your role, distinguish between mandatory things in the statutes, things that you must do and things that you may do. Show you where there are things in the statute that only apply to us. Everything that's got an asterisk by it only applies to central health. And it's literally only our hospital district has that. There are some things that I left out because they've already happened, like the election to create the district. That's one of the things in the statute. I'm not going to list that because it's kind of pointless. The mandatory responsibilities from the statute: you have to elect officers and appoint a secretary. The secretary has to keep a record of all the meetings, but the secretary can actually delegate that to the staff and then sign off on the minutes, which is the way we approach it. Appointed administrator, that's Mike. The CEO is the title. We have get the formal title for the administrator. Have a district seal to be kept by the secretary, which is also delegable. So the staff is keeping that seal for our secretary. Manage, control, and administer the district. That's basically be a board. Run the district from the board level. Encourage and promote participation by small and minority businesses in contracts. Develop a plan to identify and remove barriers to such participation. Right now, you're doing a hub disparity study, to ensure that you're meeting this goal, which is a good thing. This is a statutory shall, so it's a good idea to take steps to make sure you're doing that. This 072 is kind of an interesting one because when other districts' patients are treated in our system, we're supposed to get reimbursement from them and vice versa. All this applies to all of the different districts. So it's sort of a cross reimbursement requirement. Direct the administrator's preparation of and approve the annual budget. So that's one that you do every year. It's a long process. It begins actually in a month and a half, 2 months, and then we'll go through the summer and into September. And then find a place to put the money. So have a depository for the cash. These are things that the board may do. Designate an assistant administrator. The board has chosen to do that, and in the bylaws, that is one of the things that you have chosen to get yourselves to do. That is parallel for our new members. Appoint or hire appropriate medical and technical staff. Now these two are kind of interesting because the first one passed first. It only applies to central health, and it was you can employ physicians but not for direct patient care. Then in the last legislative session, they passed one and said you can employ physicians for direct patient care, but they left 0281 in there, so they're both in the statute still. It's a little bit of an oddity. Establish a retirement program for district employees. The board has chosen to do that. That's been in place for several years. Adopt rules governing the operation of the hospital system. There are some rules in place, including the LPPF, which has its own rules section. And this last one you'll see is also one of the ones with an asterisk, and that is contract with a public or private entity to provide district services. So that could be what's called a P3, a public-private partnership, or you could do a partnership with the city of Austin or Travis County to provide district services. And another thing that's in, this is B and C, that's B, and C is enter into a lease for property. So you can lease property to someone, or you can lease property from someone without going to the commissioner's court. That is interesting. That is a power that only this district has. The board may exercise eminent domain. I don't know that we would ever take property, but we could. Accept gifts. The board has accepted some gifts, and I understand there may be some other ones that may come before you. This is one that causes a lot of misunderstanding, 281056. The board may sue or be sued. That is not, for those of you that are familiar with government operations, that is not a waiver of sovereign immunity. This district has and continues to have sovereign immunity, even with that language in the statute. This identical language applies to the Dallas County Hospital District, and quite a few years ago, I think in the 80s, somebody sued them and they said, we're immune. And it went all the way to the Texas Supreme Court. And they said, yes, the immunity is not waived unless it's very clearly and expressly waived. 0565, create a charitable organization to arrange for services, develop resources for services, provide ancillary support. Charitable organization, community care, I believe fits under this.
Community Care Collaborative, CCC.
Yeah, CCC, I'm sorry, not CUC. I always do that. Create a captive insurance company, Sendero. Extend a contract with a depository. So you can make the contract and then you can keep it going. And then this last one is call an election on a tax rate above the voter approval rate. That is when you're doing the budget and tax setting season and the tax is above a certain rate that you're allowed to raise it without an election. This is the authority to then call an election if you need one. Now, these are all Mays, and these are Mays that you can only do if the Travis County Commissioners Court agrees that you can do them. So contract with the state or federal government to create or continue a retirement program. So we could have done a retirement program that stepped into the state or federal program. This next one, 0475, rename the district, was specific to Central Health, and that was done because we are technically the Travis County Healthcare District, and the district was given a DBA of Central Health. Prescribed purchase methods, accounting and control procedures, those have been delegated from Travis County for years, and there are documents that describe that delegation. Sell, lease, acquire, construct, develop, condemn property, lease or lease purchase real property. So this is a general lease, not a specific lease as is covered in the Central Health specific, but basically when we buy land or we propose to buy land, we have to go to Travis County, which we will be doing on the matter that's been before you in closed session. Enter intergovernmental agreements with the federal government, state, other governments, private hospitals for your powers under 050, so the property. 0511D, so I remember I mentioned 0511, which was the lease property and go into a joint venture. Lease undeveloped or vacant land to generate revenue for the district for up to 99 years. Enter into a joint venture for such lease or development. That is the Brackenridge tract. So this is the authority for doing the long-term ground lease for the Brackenridge tract with the approval of the Commissioners Court. And lastly is issue certificates of obligation, which goes along with what we were talking about earlier on that plan. Now we'll move into the bylaws. So that was all the statutes. That's all the stuff that the legislature has given you to do. These are the tasks or subtasks that you've given yourselves to do. And this is what I covered in the orientation for Manager Matwani and Manager Brinson. The board has instructed itself to be the governing body, approve the annual budget, retain auditors, and accept the audit annually at an open meeting. Select a depository for funds of the district. So that's straight out of the statute. That's sort of telling yourself to do something the statute told you to do as well. Appoint the president, CEO, and a compliance officer. So that's Mike and Mackenzie. And the assistant administrator as well. That's again statutory language. Approve, adhere to, and enforce policies developed for the district. So this is your policy setting role at the highest level. Seek approval from the Commissioners Court as required. Again, it's following the statute. Approve, modify, or deny contracts. So the contract authority is in the board. And it says unless otherwise delegated to a committee or the president, CEO. So you've done a contract delegation document that delegates certain things to Mike, and he's allowed to subdelegate certain things to his reports as well. Develop a philosophy and strategic goals. You've done that, and they're reported on routinely. Serve as an advocate for the district. Appoint members to governing boards of affiliated entities. So there are other entities for which the Central Health Board has the authority to name members and then meet other requirements imposed by law. That's just sort of a catch-all. And that is all I have, ladies and gentlemen. And I am certainly available for any questions. I will stop sharing now so I can see everybody in case a hand goes up.
Questions, anyone for David? I know some of this is very cut and dry. Yes, Amit.
No, I just want to say that that's about as good as that kind of presentation. Thank you so much.
Yeah.
Quite welcome. Thank you.
Yes, clear, concise, and to the point. Yes, Manager Balladette. Cynthia.
Thank you. You know, since I always feel that it's important for us to get little refreshers, I was wondering whether or not David could send out his presentations or the notes that he is providing to the new board members for us so that we can review and refresh the memories of our old orientation days.
Yes, I think, Perla, aren't we going to make that available to the members?
Right.
So we created a board manager resource book for the new manager orientation, and we also want to share that with all board managers. And we actually have it on, it's an electronic version, and we'll send instructions for you to access it. And Cynthia, if you need me to print any of that stuff, I can do that.
Thank you. Thank you. Manager Musaitif.
Thank you, Mr. Duncan. That was great. I have a quick question. You mentioned something about gifts. What were you referring to in terms, are they gifts to the organization?
Would that be a donation, for instance, David, like a donation to us?
Correct. Right before I started, I actually attended a meeting before I was hired just to kind of see what the organization was like. And there was a gift from the surviving spouse of a gentleman who had received treatment from, I believe, through his MAP membership, through his Sendero membership, and that had to go to the board. And so anytime someone would like to donate, or a charity is going to give us some kind of grant, that will come to the board.
Right. I remember that. It was quite compelling.
It was touching. I was.
It was.
There wasn't a tear-jerking.
There was not. There was a dry eye in the house. No. Anyone else? If not, we will move on then to discuss agenda item 2, discuss board compliance policies and procedures, including A, CMP-001 compliance program description policy, B, CMP-0010 code of conduct and ethics for board members policy, C, CMP-006 reporting and non-retaliation policy, D, CMP-009 duality and conflict of interest policy, and E, CMP-009P duality and conflict of interest procedures. And we have with us Mackenzie Frazier, who will be presenting. And board members will be asked to complete and sign their annual disclosure forms as part of this presentation. I think that it will obviously have to arrive to us virtually with a virtual signature. Mackenzie, please.
Great. Thank you, everyone. Hello, board managers, and thank you for today's presentation time. My name is Mackenzie Frazier, and I am the compliance officer for Central Health. In overseeing a compliance program, as the compliance lead, I must ensure that our compliance program not only aligns with our needs, but it must also align with industry standards. In our space, there are 7 elements or industry standards that must be in place to ensure that a compliance program is effective and efficient. These elements are implementing written policies and procedures and a standard of conduct, designating a compliance officer and a compliance committee, conducting effective training and education, developing effective lines of communication, conducting internal auditing and monitoring. 6, ensuring standards through ensuring standards through well-publicized disciplinary guidelines. And 7, responding promptly to detections of offenses and undertake corrective actions. To the element of implementing written policies and procedures and standards of conduct, in today's presentation, I'd like to review with you some compliance policies and procedures that not only support the structure, but they support the culture as well as the transparency of the Central Health Compliance Program. The first policy we have is the compliance program description. And just to highlight these policies, the compliance program description, in partnership with the Central Health Code of Conduct, this policy provides a summary of the compliance program structure, responsibility, and core components. Are there any questions on that policy?
Managers, any questions? I'm not hearing any.
I just have a question.
Yes, Manager Valadez.
Okay. I'm just seeing page 2. I was stuck on page 1. Thank you. That's okay.
No worries, no worries. Second policy is the Code of Conduct and Ethics for Board of Managers. The Code of Conduct and Ethics for Board of Managers is a set of standards for the legal and business practices of conduct that is required for all Board of Managers to comply with applicable federal and state regulations that govern not only Central Health's governance, but to provide guidance to the Board of Managers on their conduct and practices. Are there any questions on that policy?
I'm not hearing any.
Awesome. Moving to the next policy, reporting and retaliation. This policy is of importance to you all because staff are made aware that in addition to making a report to management, human resources, compliance, or the hotline, they can make a good faith report directly to the Board of Managers. It is the policy of Central Health to require all employees to make a report of relevant perceived wrongdoing and suspected violations of compliance policies and to protect reporting employees from retaliation when they make these reports in good faith. So again, in addition to the employees being able to make reports to management, human resources, compliance, and our hotline, they can come directly to the board and make a report. And they are made aware on that periodically and on an annual basis. Moving to the next policy, duality and conflicts of interest. It is the Central Health policy that all decisions and actions of members of the Central Health Board of Managers, officers, supervisors, and employees are made in the manner that promotes Central Health's best interests and avoids the perception of conflict of interest. And as we are all aware, it just takes the perception of a conflict of interest to cause questions. Moving to the next supporting document, attachment A. This document is in your packet, but it is an informational document that the employees have to sign on an annual basis that pertains to their conflict of interest. As it pertains to their conflict of interest, as it pertains to their work here with Central Health. Moving to the next document, the standard operating procedures for the duality of conflicts of interest. The standard operating procedure is in place to assist employees, including the Board of Managers, in understanding and complying with Central Health's duality of conflict of interest policy. It is the duty of all employees. It is the duty of all employees and individuals to disclose at hire and initial contracting any situations that may be perceived a conflict of interest or a duality of interest. With that, just moving through the policy, I would like to highlight some of the processes as it pertains to the standard operating procedures within the policy. So first, to call out some of the statement disclosures that are required for Central Health staff, we have the new hire attestation. So our staff are required to sign annually the new hire attestation, and that is attachment A to the packet. And again, this is an informational document for you all. In addition, staff are required to sign an annual attestation, as well as a situational attestation if something in their environment changes, as well as the CEO is required to sign an attestation around he or she's financial statement. As it pertains to the Board of Managers, the document that supports the SOP from you all's perspective would be attachment B. And that document is entitled the Statement and Interest Form, and that's what we have for you on the screen. In addition to this document, there is an Exhibit A, that Exhibit A lists all the contractors that have a contract with Central Health. And that is the supporting document to the attachment B. And that would be the first document that would cause for you all signatures tonight. And that is the attachment B, Statement and Interest Form. In addition, we have the conflict of interest form, and this is the form that's before you, the form CIS. And this is the form. This is a form that comes from the Texas Ethics Commission. In addition, we have in addition, you all could potentially be asked to do an attestation on your personal finances if those finances are could potentially have a conflict with any of Central Health's business. Further within the policy and procedure, or the SOP, it outlines how we as Central Health would determine if we were faced with a conflict of interest or a duality of interest, how it would be divided or seen over between the Travis County Attorney's Office, as well as myself in support of the board. And that brings us to the end of the policy and procedure around duality and conflicts of interest. So again, the only two forms that would require you all's action tonight would be the attachment B, which is the statement and interest form, supported by the Exhibit A, which lists out all of the vendors of Central Health, as well as the form CIS, which is the form that's pushed from the State Commission's office.
Okay, what are the instructions for us virtually signing these?
So Perla, I can gather these up and get them out electronically versus sending them hard copy. We can discuss that online if you would like.
Perla, what did you have in mind?
We emailed the forms. I don't know if there's the option to sign electronically. We can research that. For those that can, you could print them out, sign them, scan them, and send them back to us. But if you're not able to do that, then we will see if we can incorporate electronic signature.
Okay, actually, you don't even have to scan them. You could print, if you have a printer, you can print them out, sign them, take a photo, and send the photo. Right?
That's true. Yes.
So you don't have to have a scanner. But for others who need other options, you will work with them, right, Perla?
I will work with you individually if you need
Okay.
me to, print it out and mail it to you or drop it off at your house.
Okay. Thank you.
Yes.
Managers, any questions? I did want to get those details taken care of. Questions? Managers? Manager Jones.
Yeah, I have a unique situation here that I just have a question on terms of, presently I'm on leave of absence from the board. And as it relates to that local government official conflict form, I need to get probably a little more guidance at another time. We don't have to do it now with regards to that. For my tenure, any action, I'm not going to be voting on any action if it's acting tonight because I'm just here visiting.
Right. Why don't you meet with David Duncan one-on-one and he can advise you specifically. And anyone who has any specific questions, then my advice to you is to contact David Duncan, and he can via phone or Zoom meet with you specifically to discuss any questions you might have about your situation. Would that be appropriate, David?
Yes, ma'am. And I'm at your disposal, Manager Jones. And when you started this arrangement, I had discussions both with my colleagues on the other side of the fence in the county attorney's office and with the city attorneys. So we can do that again.
So I'll let you, Manager Jones, take that up specifically with David off. Okay. Anyone else have any general questions at this time? If not, if you have specific ones, then contact David Duncan. Okay, I'm not seeing anything. And again, we've been emailed the forms. If you have the ability to print them out, sign them, and you don't even have to scan them. You can just take a photo and send that to Perla, or if you can sign online. If you don't, contact Perla directly, and she will make arrangements with you to get you the forms so that you can sign them and get them returned. Thank you.
Sherry, Brianna just reminded me that one of those forms may actually have to be notarized. So we'll work individually with you. Rachel Snow, who works with Travis County, was able to help new managers
Oh, you're right, because when we met in person, we did in person, there was
We had a
someone
notary on
we
site.
had a notary on site. Okay, so
Yeah.
Perla will contact us about that.
Right.
We'll contact each of us. All right, thank you. Manager
I'm a
Valdez.
notary. If anybody needs anything notarized.
Okay, well, we may have the dynamic duo here. Thank you. All right.
Have notary seal, we'll travel.
Thank you very much. Okay. Well, with that, if there's no other discussion, we'll move on to agenda item number 3, discuss Central Health's mission and budget alignment. And I will open it up, and then Mike Giesland will be presenting. So members, I think that it's always good as part of this annual retreat to have a refresher and to really just spend a minute to contemplate, why are we here? And I mean specifically on this board of managers for Central Health. And it is to carry out our mission, our Central Health mission, and as a board of managers, to be united and focused on that one mission, right? Which is, I'm not going to repeat our mission statement, but I think that it is, to provide the absolute top-notch healthcare for those who need it most in our community, right? That's why we are here. And when we think about that, what we do every year with our budget is make sure that we're aligned with our mission, our overall mission, and that we are aligned with our strategic plan and our goals within that. And I think that's very important. Whether we have a formal, performance-based budgeting or not, it doesn't really matter. No, we don't necessarily have the formal performance-based budgeting with, outcome measures represented on the budget, but that's not necessary. What I think is necessary is that we rally around and focus on our common mission, and that we do have a strategic plan, which we certainly do with our strategic planning committee, where we have annual goals and objectives, right? And longer term ones within that strategic plan. And then we build our budget based on that strategic plan, and we pass a budget resolution that then aligns with those goals in the upcoming year for the strategic plan. I used to always say when I teach public financial management, the budget is the essence of public policy, right? If you want to know the real public policy of an entity, look at what's funded and how much money it gets. And so aligning our being unified on our mission and being focused on that, and aligning that with our strategic plan, and then aligning our strategic plan with our budget, and with our budget alignment and through our budget resolution, I think is very important. And with that, Mike, I want to turn it over to you.
Thank you, Chair Greenberg. So I'll pick up where Sherry left off. And when we talk about focusing and budget and mission alignment and strategic objective alignment, the question is, what's the transition from what the board does over to what the staff does? And so we do have a slide deck that I'll cover a few of these slides, but starting off, the question is, why do we do what we do at the staff level? And just like the board, you've got there's statutes, there's mission, there's community, there's resolutions that you all pass. So there's things that you do that then translate into what we do day in and day out. Also, on a list of this last, but certainly not least, professional fulfillment. We do this because we enjoy this work, and we are wholeheartedly committed to the mission in serving the community. So we'll go to the next slide, but I want to focus on 3 of these elements. And if you'll go ahead and click through, I'm sorry, if you go back to the last slide, the resolution by the board, the budget, and the strategic objectives. And this is where the true interface is between the board and the management team. So we'll go to the next slide. So I think it didn't translate over into PDF, but on the PowerPoint version of it, I'll note that the budget resolution is a foundational document. Chair Greenberg mentioned this, and this is passed every year, April through September. And what it does is it sets forth what of the budget is actually being adopted, but then also what are those strategic objectives. And actually, if we could pause here, Brianna, if you'll allow me to share screen. I'm just going to shift over to the PowerPoint version. I think it picks up the content a little bit better. Okay, can I get a visual check on this? See
yes,
budget resolution? All right, thank you. So as I was saying, this is a foundational document and it is approved by a majority of the board. It aligns our budget with the objectives that are set by the board. It is also a document for transparency and accountability. It's outward facing, it's put on our website, it permeates a lot of our presentations that we bring to you, as well as what we say out in the community. And so it's a way of holding ourselves accountable. It's the basis for reporting and meeting agendas. You'll notice, like for instance, in the most recent Strategic Planning Committee meeting, there were a couple of presentations and they always start out with, members, this ties back to objective, and there's sometimes a number listed, but we state what the objective is. So that way you know why we're coming back and reporting to you. But more so, this utilizes a strategy of organizational strengths. So our strategy has to play to our strengths. And so we take those strengths and the position that we have in the community and in the statutes, quite frankly, to achieve the mission. So again, as I mentioned earlier, this all starts out, at least for the board, in the April time period, when we start talking about what are strategic objectives, we start bringing back reporting items, and we start building the strategies and then the budget to support those strategies, and that's ultimately adopted in September. Now, these timeframes overlap, and some of these boxes here speak to a lot of staff activities that happens throughout the year. But during the budget season is when the board, and this is important to remember when you think, the position that you hold, this is where you can really influence what happens in the community. When you take setting strategy and you align the budget, and as Chair Greenberg said, the budget being the ultimate expression of policy, this is where you can exercise what David Duncan had laid out as your responsibilities and your duties to really affect what happens out in the community. Now the question is, how do we line up from a management standpoint? And it's rather simple. We talk about the purpose of why we do what we do, and this really, it's not just management, it applies to all staff. But then we come back through the board, and this is where that alignment of setting strategy and the budget occurs. Then that goes through executives and departments. And there's an executive sponsor for every major initiative that we have, but then obviously the executives can't do the work by themselves. And so we are completely dependent on very talented teams and staff and departments that we have working with us, and also working cross-departmental. But then it comes back to the executives, because ultimately, if I'm held responsible to the board, I need the executives reporting up, where we are with the various objectives that the board has established as priority. And then we start this over again. But the point being is that we make sure that the decision-making, the information, the work collaboration, and the accountability will be aligned into a single flow. Now, one thing that I'll just mention briefly in closing is strategy overview. We won't cover this in depth, but it does speak to alignment, and we need to come back and talk about it in subsequent retreats. You'll hear a lot about this also as we report to Strategic Planning Committee, and then as we start the budget process, as I mentioned earlier. But we have a natural strategy. When you think about our given and evolved strengths that we have, and we apply that to fulfill our mission and the related board objectives, we work with a natural strategy, if you will. And every organization has one of these, and it's really a function of where do you find yourself in place and time, and what strengths do you have that might be given. In this case, statutorily, we have a strength, and that is to raise local revenue so that we can then in turn reimburse healthcare providers to provide care to those that are in the medical access program. But then there are operational strategies and culture that are very much a part of our strengths and who we are. And I distinguish between these two for reasons, I think fairly obvious reasons, but just to cover it quickly. Operational strategies might be things that change from one year to the next. So for example, our communications outreach and engagement. You've recently received an update from Ted Burton and his team on this at a strategic planning committee meeting a couple of months back. That's one example of an operational strategy that supports overall what the organization is trying to do. But then from a culture standpoint, these are things that are in essence who we are. It's what we aspire to be. And so for example, the hub development work that we've undertaken, our workforce diversity, equity and inclusion work, and really focusing on how do we have HR strategies that make us a more diverse, equitable and inclusive organization. And this is important from a cultural reasons for, we could, each have different reasons why it's important, but just to share, personally, in my experience, organizations that are this by choice and that embrace equity and inclusion and diversity, you're more creative, you're more nimble. When you think about whether you have people that have lived the experience or that by affinity are close to it, as however that they hold themselves or present, it brings you in closer touch with the communities that you serve. And so in addition to being creative and innovative, you are also more connected. So those are some of the strategic overviews. We'll spend more time on that. I just wanted to touch on it, but it's what helps us also keep aligned. So that concludes my remarks, and I appreciate your indulgence. Thank you.
Thank you, Mike. Members, any questions on the mission and budget alignment? Yes, Manager Valdez. You're on mute.
Notation. I'm one of those that believes in building from the bottom up. So if I think of what I was, and I know how Jason does it. That's why I'm so glad we have Jason over at Community Care, because he was the first person to bring into play a real community needs and assessment that had never happened at Community Care in all these years. It had never happened. So I'm very proud of that. With me, it's okay. It's Central Health. Are we using Jason's information, data that he has gathered in looking to see what our community needs are as a basis or as a foundation for what we need to do to accomplish our mission? And that is to provide the indigent, the vulnerable, and the uninsured or the underinsured population what it is that they need, the medical and the hospital services that they need to have in order to attain a higher quality of life. And in knowing that and in believing that to my very core, how is that what staff is doing? Are you all gleaning that information? And are you all saying to us, when you make your recommendations, this is what we have garnered, the data that we have, and this is what we're recommending that you all do in order to make sure that those needs are met.
So
I'm curious in my head as to, I think
what you're asking,
this all comes in, because we have philosophical conversations, but data-driven needs and
right. That's Cynthia, I really appreciate what you're saying and what Jason has done. And I think what you're asking, if I understand correctly, is staff being driven by the data and the evidence? Is it data-based and evidence-based on our actual community and population we're serving? Mike, is that correct, Cynthia?
Right, and as that information is incorporated into our plans, that is also the foundation for our need to look like our community from the top down.
Right.
Okay?
Right. Yes, and
in order to accomplish that, we have to look like that from the top down. The same information has to come from the bottom up.
From the grassroots, not the grass tops. Right. Okay, Mike.
Right.
Yes, and so I'll respond to that in reverse order. And absolutely, when you think about how we look from the top down, but also, to a person, what we understand, deep down in our hearts about other people, I think is also critical to being diverse and inclusive, like and seeking by choice that level of understanding. So that's an important part of who we need to be in our culture. Now, in the second part that I wanted to bring up, and this kind of speaks to, universally to what you were bringing up about community care and their community needs assessment, is I'll point to the third bullet point here. It's the second sub-bullet point under natural strategy, where it says strategic convener leader in health systems and equity planning. And this is something that's been briefed recently to the strategic planning committee, but yes, it encapsulates just that right there. It's all of these data points and research reports that we have, including our own demographic report, where we talk about disease prevalence and health disparities in and among communities and communities of color. And so I think that that's what you just mentioned, plus a whole lot more, even within just our own data sets that we have about the medical access program and the individuals that we serve and aspire to serve. It all gets put into what I would say that bullet point right there, which is obviously an understatement, but it's certainly meant to capture exactly what you just said and what you've seen in the strategic planning committee.
Well, with that being said, Mike, I really would like to at some point in time have on maybe at least once a year prior to budget, I'd like to see what we need to do to support integral care for our behavioral and our mental health needs and the services that they provide to our population. Okay.
I'm sorry, Manager Valdez, it cut out. It could be
integral care. She was talking about integral care.
Okay, thank you.
Thank you. Anyone else on this item? Not seeing anyone. So if not, thank you. Thank you, Mike. We will move on to item number 4, review the annual calendar and timeline for reporting on strategic objectives. And Perla Cavazos and Brianna Yanes will be presenting.
Managers, we just want to give you a brief outline of the annual calendar, which you've seen before, and it's in the resource book. And then I'm going to give an overview of the schedule for reporting out on strategic objectives.
Okay, so this is just a reminder of our annual calendar. A few things to note that we will only, as of right now, we will only be having budget and finance in January and in June. We will have 2 Board of Managers meetings in August and September, and that is because we have a public hearing in September. And we will not have Eastern Crescent or strategic planning in September because of the public hearing. And we will not meet at all in July. And that is all I have about the calendar.
And members, we've discussed these adjustments to the calendars previously, as you will recall, to be more efficient, to let staff have time off in the summer in July, and to have budget and finance in January with the audit, and in June with the budget preparations, and then to have extra meetings because we have to meet as a full board on those items anyway. So trying to be more efficient. And then in September, since we have the extra meetings, we won't be having a strategic planning in Eastern Crescent because we're doing all of the public hearings and budget meetings.
Right. And Brianna, is there any way to enlarge and that's make that bigger? So Mike talked about the budget resolution and strategic objectives, and he talked about the flow that we have as staff working through these board approved strategic objectives. And we have different schedules, and I tried to distill everything into one page for you to just see at a glance when we are reporting out on these, again, these board approved strategic objectives. The expansion of services and those clinics in the Eastern Travis County, Most of that reporting was being done in Eastern Crescent, and I think that's been moved to strategic planning for now until Manager Jones comes back to chair that subcommittee. We also have had updates at the regular board meeting in January, where we laid out the project plans. And then we should be getting an update in April and August, according to our schedules. And again, I just want to say that this is the plan. Of course, sometimes things happen and we have to move things around. I think we had a full schedule in February, but because of the freeze, we had to shuffle some of those presentations.
Right.
So this just, I'm putting out a disclaimer that things are subject to change.
We certainly saw that with the pandemic and COVID-19, right? And yes, again, with the freeze and power outages, yes.
Right. We will have updates on, we have very regular updates on workforce and the hub disparity study and hub work plan. As you see there, there are multiple reports, that started in October, November, December, January, February, March. Pretty much it seems like just about every month we have some update on some of these cultural objectives. COVID response, we started off the beginning of the fiscal year with giving presentations at board meetings because, it was new. We were trying to figure some of that out. I'm sorry, at the beginning of the pandemic, last March, April, May, early on, we were doing board presentations. When we saw that the COVID pandemic was going to be around for a while, we switched to doing weekly updates to the Board of Managers by email. And now we've moved into biweekly. So I'll be sending an update, for example, this week, not next week, but then I'll send one the following week. And then, however, we are, going to try to present some information in the board packet that's a little bit more comprehensive than what I'm sending in emails. For example, for the board packet we're sending out on Friday, I'm getting some operational updates from Community Care and Sendero with a focus on vaccines, as well as some financial information from them. So we'll be doing adding that information in your board packet on a quarterly basis. Systems strategy and health equity development. A lot of that reporting is happening in Strategic Planning Committee. And we do have an update at the March 31st board meeting. We have a special presentation and then another presentation in June. Specialty care, also that reporting is happening at Strategic Planning Committee and at the dashboards. The MAP call center was also a strategic objective. However, the call center went online in October, so we haven't really provided an update on that since then, but we might talk about sending a written update to let you know how that's going. I combined Epic and the telemedicine, e-consults, and virtual care. We had a board update in November, and we might provide another one just looking at what the calendars shake out for the rest of the year. Case management and outreach, that reporting is happening at Strategic Planning Committee. Hospital payment model on the downtown campus. As you know, we get reports in closed session as needed. And then maintaining our financial, maintaining our reserves, that is being reported mostly along with the budget. So we had some information in October. We did have an update in January April, June, August, and September. There's also some quarterly financial historical review that Lisa Owens is presenting as well as part of these reserves update. So that's it. I just wanted to share with you in a snapshot so you can see that, you know, we are keeping you busy throughout the year, reporting out on the strategic objectives that you approved. And so unless there are any questions, that concludes this agenda item.
Thank you. Members, are there any questions? Manager Musaitov.
Yes, thank you. Mine actually goes back to my committee. I never heard back from you in terms of ad hoc women's health, and it's not on the calendar. So what is the plan?
I have been in discussions with staff about that, and I will report back to you. We have made progress on scoping that and on identifying staff. So we'll get back with you, and then can see when it would be appropriate to schedule. So I will be getting back to you. We, as Perla said, sometimes there are things that we can't anticipate, and the power outage and all of the things around that put us a little behind on some of our other planning. But yes, I have had a specific conversations and feedback from staff, as a matter of fact. So I'll be getting with you. Anyone else? Mike, yes.
Chair Greenberg, if there's no other member questions, just a couple of quick comments. One, what Perla showed you was the interim reports that we do along the way, and obviously, we can queue one up. If we got the data available, or if it's more narrative, that's a little bit easier to do. But also, as we go into the budget season, we come back to each one of those objectives, and we do kind of what I call a wrap up, where it's like, okay, here's where we wound up on this, because some of those strategic objectives, as you all know, it spans multiple fiscal years. And we need to say, okay, did we hit the milestones that we wanted to make this time? But we do provide, as part of that budget process, that wrap-up type reporting. The other just preview that I wanted to give you a heads up on is on our hub reporting for last fiscal year. So this will be for FY20. We do have that report ready. There was another slide that we needed to drop in to show some historical perspective. That was done earlier today. And then so we're going to be pushing this out to you as an advanced copy tomorrow. I will say that while we've made some improvements, we still have a lot of work to do, but I think it validates the work that Lisa and Belina and others in her shop are doing, but also our disparity study that we're doing with Colette Holt and Associates. Thank you.
Thank you. Members, anything else on this item? Okay, not seeing or hearing anything, then we will move on to agenda item number 5, discuss the procedures for requesting information from Central Health employees, including those assigned to enterprise affiliates. That's number 1. And number 2, the addition of items on board or committee meeting agendas, and Mike Giesland and Perla Cavazos will be presented. Mike, you're on mute.
Okay.
Yeah.
I'm going to share just, so what we'll ask is that if there is a information request from a board member, is always try to run it through the board manager, in this case, Brianna. And what we'll do is we'll review those periodically, and sometimes we'll have to reprioritize those. But what I would say is a 30-day default. And I realize that seems like a long time, but we will certainly aim for less. And sometimes we batch up answers, like we bring you one batch of whatever it is that you asked for, and then we come up with a follow-up, or you have some questions. And so we want to try to do all of that within that 30-day window, both any, the initial or any subsequent responses and follow-up. But we'll certainly aim to do it in much less time than that. But we need the flexibility to reprioritize. And here's what happens is when you look at how we're situated, we don't have a dedicated staff for board research. Those people that do that, whether it's in the finance department, data and analytics, and the strategy, and the CEO department, they've got other things that they need to be doing day in and day out that ensures that the work that's been directed by a majority of the board continues. It's running the business of the healthcare district. And so sometimes we'll need to reprioritize based on what we have going on. So for example, if you have a lot of questions around a certain financial element or aspect, and it's right as they're trying to wrap up the field work for the audit, we'll need to prioritize the audit first, because that's something that the board must do. Whereas if your inquiry can wait a little while, we'll need to do that because the finance team is all wrapped up in completing the field work for the audit. So that's just not a hypothetical, but a real example. The other reason is sometimes we need to handle more sensitive time requests and matters. And that obviously is borne true during this pandemic, and then most recently with snowpocalypse. But sometimes some of you may have a request, and let's say that you have a speech in front of a group and you're going to be speaking as a Central Health board member, and there's going to be, it could be a Facebook Live event, let's say. And so obviously we need to get that information because that speech is more timely. Whereas sometimes if you've got a request that, you know, it's really just for my own edification, meaning as a board member, I just want to learn more about this. We need to prioritize that speech request because obviously that person's going to be outwardly representing Central Health. And so we need to take care of that, which means we may have to prioritize those requests that are more for edification purposes. So that is a summation of what information requests need to be like. The main thing, if I'm in your shoes, what I would want to know is run it by Brianna. If you forget, and run it by staff, turn around and CC or forward that request to Brianna. Staff is also going to be instructed, hey, if you get something, make sure Brianna knows about it. That way we've got somebody looking at all of those and we can try to manage the requests as best as possible, as well as staff workloads for the day-to-day business of the healthcare district. Thank you.
Thank you. Thank you, Mike. And managers, this is, you know, again, to be as efficient and effective in our mission as we can be, which is providing the best healthcare to those who need it the most. And we, you know, we run a lean operation, right? If you look at you know, the amount of staff we have and all that we do, and then things that come up, as we've talked about, that are beyond our control, whether it's a storm gate or the COVID-19 pandemic and many other things that so affect our population and our operations. So I think this is very reasonable, right? That you know, we have to look at the priorities, and particularly with the lean staff we have, the things that are must do that they're already working on, or something that could come up that's an emergency or very timely, and give that 30-day window, right, to respond to, you know, those other information requests. As I said, just trying to be as efficient and effective for everyone, and frankly, also to be fair to our staff, right? They work really, really hard, and we want, you know, we want to make sure that we're being fair to them too, and taking into consideration, because I know that we have staff that, if we didn't intervene, sometimes would be working 24/7, 365 days a year. So I will leave it at that. Members, anything else on this item? Perla, yes.
Mike, I saw in your slide that you also had agenda items.
Oh, yes.
Did you cover that?
I could cover that. So members, you will recall, some of you who were here a year ago when we had, it was a little over a year ago because it was one of the last in-person things I think we were able to do. We had a board retreat in person that I reinstituted having the regular executive committee meeting. So you will note that before every board meeting, we have an executive committee meeting. And I wanted to do that to have an open, transparent forum for members to bring up issues, scheduling, and other things. So we instituted that. I hope that you feel that that is working well. And if so, I would like to continue that. Any thoughts on that? Is that working well and should be continued? That's certainly my inclination, unless you have other views. Okay, then I'm taking the silence as you think that is working and you want to continue that. And so that's what we will do. We will continue having those executive committee meetings prior to the board meetings as a way for all board members to participate in planning and, agenda setting and being transparent. So thank you, members. Perla, was there anything else?
Yes, and for committees, I would also suggest speaking to the chair of that particular committee.
Of course, yes. For committees, absolutely. Please, whether it's an ad hoc committee meeting that is having a meeting, or right now we don't have any subcommittees meeting. We only have one, and it is part of strategic planning, but with Manager Jones on leave, or meeting as part of that. But with committees, certainly if there are items that you want to discuss, being mindful of not having a walking quorum, or agenda items, please do go directly to the chair of that committee or ad hoc committee or subcommittee. Absolutely. Thank you, Brianna. Anything else? And of course, as we were talking about, those committees are staffed too. So, the chair of that committee or ad hoc committee or subcommittee, will typically consult with staff too on scheduling or information needed. And we do have staff members who are assigned to the committees, and including ad hoc and will with the women's health in addition. Anything else? Perla? Cynthia?
I want to make sure. Yeah. I just wanted to tell you that I agree. I agree in the use of the committees to vet items and to get information so that we don't occupy double time in board meetings. And I think that was why you had, during your tenure, you have increased or stepped up the ability to use those committees to vet. And I just want to tell you, I think it works fine. Thank you.
Well, thank you. I appreciate that. Okay. Anything else, Mike, Perla, members, before we move on to the next agenda item?
No, I maybe it might be fair to say that there may be instances where, and we could discuss this at executive committee, where a written update might be more appropriate when an item is recommended. And again, that's just in the spirit of budget alignment and board efficiency, which we're working really hard these past few months to improve upon, because I know everybody's time is valuable. You as board managers are volunteers, right, and want to respect and work in the most efficient way possible to get you the information that you need.
And I think we'll talk about that a little more in the next agenda item. So that's a perfect segue. Anything else, managers? And we'll move on to agenda item number 6, discuss techniques to improve board meeting efficiency and effectiveness and receive training on Robert's Rules of Order and commonly used motions. So I'll start this off, and then Brianna will have some items, as well as Mike and David will present regarding Robert's Rules. But let me just say for opening, that was a great segue into this, to try to be as effective and efficient. I realize that you all are volunteers. I realize that we all are so dedicated to this mission and have in our hearts and souls, serving, providing the best possible healthcare and health and wellness to those who need it most, who are often in very difficult situations, in an equitable manner. And that is what we want from the bottom of our hearts. And so I want to be respectful and mindful of your time as volunteers, and to run our meetings as effectively and efficiently as possible. And part of that is, as Perla was saying, staff also being as effective and efficient, as I say, no death by PowerPoint, right? Or being concision in your presentations. But also there are times where, frankly, I find it more useful rather than having a presentation on board agenda, to get something in writing that I can have and digest and, and have in written form and then get with a staff as appropriate. So there are those times too. And also that we follow Robert's rules of order. And I want to say that I have been a part of quite a few organizations, some of them actual governmental bodies, as is this. We are a unit of local government, but the state legislature or other nonprofits that have all used Robert's Rules of Order. And I think it's very important, and that also that people not take anything personally, right? Robert's Rules of Order are really there so that we can be our most effective and efficient for all of us as volunteers, as policymakers, for our staff, and for the public, right? I think that's very important, that we are also respectful and of the public and have meetings that they can follow and attend in a reasonable manner. And so I did want to mention, please understand that Robert's rules apply to everybody on the board, and that they're really there to help us, and not to, if people are making any kinds of motions, it's not a personal matter. So with that, I will turn over to Brianna and Mike and David for their portions.
Hi, I'll briefly talk a little bit about the new agenda item submission form that we have been including in your board packets recently. This form was created to serve as a memo. Our goal is for this form to be included with every item on the agenda. That is, I guess, not including most or some standing items that you typically see every week, like minutes or financials. Those typically won't have this form. One of the most important items that we have included on this form are the key takeaways. This section should help you understand the highlights of that agenda item and will be what is being presented at the meeting. There are also other important pieces of information on this form, including who will present, if it's informational or action, the fiscal impact, and if closed session will be needed. We hope that this is resourceful for you. So that is a little bit about this agenda item submission form. Please feel free to let us know if there's anything that you think needs to be on there that could help us improve it.
Thank you, Brianna. Members, any questions on that? Okay, thank you. Mike?
Okay, thank you. So members, Brianna just real quickly, she went over the form, and this is designed to start the thinking process and just to tap into your tacit knowledge that you have as board members. The presentations will follow those forms for the most part in terms of the key takeaways. And so what we've asked, we had a quick training session with execs and some other staff that we're going to be presenting at the upcoming board meeting. We'll continue to do this over the next couple of months until it becomes standard and habit for us. But really focusing on covering the high points and lining up with the key takeaways as noted in the agenda form that's included in your packet. And then whenever we present data to you, especially when we present data on communities and people that we serve, have it disaggregated demographically, whether that's by race, ethnicity, gender identity, but also inclusive of identities to the greatest extent possible. And so, sometimes we're not in charge of a particular data set. We don't collect it, but we use it. And so it may say male, female, other, but if it's male, female, non-binary, or other representations or identities, we want to make sure that we're capturing that disaggregated but also inclusive identities, so that we get a sense. And Manager Valdez, you brought this up on a number of occasions, also including language as well. So that's what's meant by presenting disaggregated and inclusive data. Obviously, we're going to highlight the key values on number-rich tables and graphs. Sometimes, for example, in real estate discussions and financial discussions, there's a lot of numbers all over the page. We want to highlight what the key values are that we need you to focus on. If we were in your shoes as a board member, not that we're trying to say don't look at anything else. Obviously, we wouldn't put it on the screen if we didn't believe that. But there are certain things that we need you to focus on as board members for fiduciary reasons, or perhaps just for value and judgment reasons. And then we'll state what the value concludes or what questions it raises or what surmises. And then lastly, a steady cadence. And so we realized that whenever we're on camera like this, and especially if it's late, sometimes you just step back a little bit, but we want you to, and we're really going to try to coach ourselves, myself included, try to keep the cadence up and try to get to Q&A sooner, because you obviously have questions that need to be answered. And so to the extent that we're more efficiently using time and how we present, we want to be able to do that. Thank you.
Thank you, David. Were there any questions from Mike's presentation? Yes, Cynthia, yes.
I just wanted to ask, I've been thinking about this. I know language is a big thing for me, but also religion. There are excluded populations and specifically targeted as a result of their religion and their beliefs. And maybe at some point we should consider making sure that that's also a demographic piece of information that we need to collect in order to better develop strategies to address people's needs.
Thank you.
Yes.
Yes, thank you very much. Managers, anyone else before I turn it over to David to brief us on Robert's Rules of Order? Okay, David, the floor is yours.
Very good. I am sharing my screen. You'll see that there's a presentation on there.
Yes.
And I also have, just so I can show you all, I actually do keep a rather dog-eared old copy of this thing, and it's good to have, but it's hard to read. It's a big, long thing, takes forever. If you're ever going to pick one up, if you happen to see one sitting around, read the first 50 or 60 pages, because it's all about Colonel Roberts' life. He was actually a very interesting guy. He was a U.S. military officer many, many, many years ago, not long after the Revolution, and traveled around the country and learned that most things that he volunteered for, where he served, were very disorganized. So he decided to bring order to the chaos. So I gave him all kinds of credit for that. As I just noted, you don't have to read this thing because it's what I do. I wouldn't consider myself a parliamentarian, but I've been doing this for a while, and I've learned some tricks and cheats, one of which is, I've got it marked, there's this really interesting chart in the middle of Robert's Rules of Orders that tells you what motions are control over what. There's a big stack of them. So I will do my best to maintain order. And if you ever have a question, all you have to do is ask. And that is something we're going to cover that actually in a moment. The other thing I'd like to show you a couple of, here's what a motion is. You're calling the body to act on something. In this, the presentation here, you will see some things, little notes down at the bottom. The split black and white is a simple majority vote. A slightly darker circle is it requires a 2/3 vote. So there are supermajority votes. The little 2 requires a second. This little symbol is not debatable. And then there's a symbol for deciding whether a motion is amendable or not. A second is something, if you read all of Roberts, you'll find that a second is actually not always necessary. But in a small body like this one, a second is often seen as an indication that the body is likely to act on something, or at least act affirmatively. So they recommend we're considered a small body. They think of Congress or a big, gathering of a fraternity that's got hundreds and hundreds of members where everyone can vote. So a friendly amendment, that was just humor. Humor. So
I like humor.
Yeah. When there are discussion limits, and you will see that on some of our board meetings, someone will suggest, and there will be a quick vote on, should we limit debate tonight? We have a hard stop at 8 p.m., which I'm hopefully going to meet. And the members can all agree, hey, we're going to limit our discussion, absent questions and answers, to 10 minutes after each item. So that is something you can do. Discussion should be directed towards the chair. So when you wish to be recognized, and all of you are very good at doing that. And in this format, all credit to Chair Greenberg. I don't know how you do it sometimes with the little format that I'm looking at right now. I have 6 boxes. So I don't know when someone's raising their hand. So on general discussion etiquette, the chair will decide what order we're going to go in. She will consult with me or the other parliamentarian that's there, recognize the speaker, and monitor whether the discussion is within the motion, again, with help from us, and or the item that's posted on the agenda. One of the things about Robert's Rules that's kind of interesting is it's also related to the Open Meetings Act. You know, we have we have a statute that applies over this thing, and the Open Meetings Act controls what we can talk about on a given item. So sometimes we'll say, oh, this is outside the scope of the item. That's not Robert's Rules. That's actually the Open Meetings Act. So as far as amending and withdrawing motions, an amendment is something you use to put something in and or change a relevant portion of a motion. You shouldn't, a substitute motion is actually, that I'll talk about that in a second, but this is one, an amendment is a simple vote. It requires a second. I forgot what my own symbol is, doggone it. An amendment is amendable, so you can amend the amendment. Withdrawing prevents the need for a substitute motion. So if it comes on and you make a motion and somebody else says, well, I'd like to change it like this, and it changes it pretty fundamentally, you can say, well, I'll withdraw my motion in deference to yours if you actually like what they're doing. So you can just take it out. This is not something we're probably going to do very often, but if you watch the legislature, they'll do this. You can commit or refer an issue. You can refer it to a committee for consideration. We might do that occasionally, especially if something comes up. One of the interfaces, again, with the Open Meetings Act, if somebody brings up something new at a board meeting, so we're talking about this and somebody goes, hey, you know what we should do is we should look into doing this. You'll see me or Chair Greenberg say, wait, we can't debate that, we can't deliberate that. But how about if the Strategic Planning Committee looks at that? And Chair Greenberg will look at Chair Bell of the Strategic Planning Committee and say, would you bring that up? And he said, yes, we'll put that on our next agenda.
And I have done that before, yes.
That's basically, and it can be done. A lot of these things where you'll see it requires a second and it requires a majority vote. You can also do these by viva voce or acclamation votes where the chair will say, does anybody have an objection? And if nobody says anything, that's basically an assumed unanimous vote. Mm-hmm. So that's something that's done just to move the process along and make things a little bit quicker. A motion to postpone or lay on the table. One of the reasons that chart I showed you has the priority of motions from the main motion to other things, amending it to other, is things like this. So if somebody moves to postpone or lay a motion on the table, that takes precedence. And the reason it takes precedence is if you vote on this and the vote is affirmative, it is tabled, then that obviates the need to vote on the actual motion. So the reason it's above is you do this one first because it will decide what the body's going to do that in that meeting on that item. Now, look at this last point. That's why it's in bold. You shouldn't lay something on the table to the next meeting. You can say, we're not going to act on it tonight. Chair Greenberg, would you please put this on the next meeting? That's a different thing. So that's actually not a motion to lay it on the table. Lay it on the table is for this meeting. A motion versus a resolution. So we occasionally have resolutions. You've probably been on bodies or seen bodies act on, especially a resolution recognizing service or something along those lines. There are some things that we do that require resolutions. There are certain acts that affect our retirement plans. There will be one in next week about finance. And one thing, you can do a resolution and you can read it into the record. It has to be in writing. The record that you make of it can be it's read into the record, or that all of the members can get a copy of it beforehand. And what you vote on is, we all agree that we got this and we've seen it and we're going to vote on it. This is the thing we're voting on, that thing that you got in your backup packet. So they don't absolutely have to be read.
We read them into the record.
But it's not required.
Right.
I kind of prefer that we get away from that, because if you misread it, then it's wrong.
Yeah, well, good.
Now, you almost always want to read one that's recognizing someone for service or when they retire. You almost always want to read those into the record because they talk about the person's service and allows people to recognize them.
But others we could get in advance and not have to read them and have a
absolutely.
word listing.
Yes,
Okay,
I was actually going to talk to you about that separately for next week. Because those are the kinds of resolutions, frankly. It's a very formal resolution about finance. So it's kind of hard to read those too. Once the chair is recognized, there's no further discussion. So you've made the motion, there's been a second. The chair says, is there no further discussion? For most motions, it's 50 plus 1. On a board of 9, obviously that's 5. It is always the number of members present and voting. So if you have 5 people at a meeting, which is your bare minimum, and 2 people don't vote on something and the vote is 2 to 1, it passes. So abstentions do not count at all. Types of votes, voice vote is just, does anybody, all those in favor? Aye, done. Hand vote or, oops, sorry, I bumped that. Dang. Sorry. If it's close or if you need to know, sometimes we'll do a visual vote. Most often when we need to know, as with the tax rate, when we set our tax rate, there's going to be a roll call vote. Each person's name will be called, their vote will be recorded and said aloud to make sure that we get it right. If there's something where there's no objection, this is the voice vote I was talking about about earlier. If somebody says, wait, I'd like to vote on this, but you're going to vote, and then you're going to find out whether it gets the 2/3 or the majority that it requires. A motion to reconsider. So at the same meeting, if somebody says, you know what, I think we should look at that again. This is an interesting point on this one. This is a pretty cut and dried rule in Roberts. It can only be on, the motion can only be made by someone who was on the prevailing side of the original vote. So somebody who lost can't say, let's vote on that again. Let's vote on that again. And that just keeps the meeting moving and prevents that kind of theater. If the motion to reconsider is approved, you address, oops, that's a typo, address the previous question as the main motion. So you bring the motion itself back up, and then you can, it could be amended again once it's brought back up. Motion delay on the table, you can set it aside temporarily. That we've already covered. And in summary, Robert's Rules, it's a big thick book and it's got lots and lots and lots of exceptions and you know, notes and things like that. But the basics, the kinds of things we use it for, it is fairly easy to follow. Wait until you're recognized. If you're going to make a motion, wait for a second before people start deliberating it. It's all pretty straightforward. Now, I do have a motions chart. I have a cheat sheet that I will send you, and I apologize, the version I sent with the meeting was not gender neutral, and I didn't notice that. So we're going to fix that, and we're going to send it out again, so you will all have it. And you'll find that the more we do this, the better we get at it. Chair Greenberg is an expert. She often picks up on these things before I do, especially vote counts and things like that. So she's as much a parliamentarian as I am, I think. But I will always keep my little brown book handy, and if a dispute happens, I may say, okay, we need to take a short recess while I reread that chapter. Mm-hmm. But I have actually done that during board meetings. I have gone back and reread particular parts of it to make sure I'm ready in case that comes up. And with that, I will stop sharing because I'm sick of looking at PowerPoint and ask if you have any questions.
And understood. There are, and some of this you will see, you know, the legislature's in session, so you'll probably see some public bodies are even more formal when you'll see a member of the House, for instance, get up at the back mic. They're asking for recognition, you know, and they'll say, for what, you know, purpose, member, and you'll say, you know, you'll state your purpose, and then the Speaker of the House will recognize you. And then you can ask your question or lay out your amendment or whatever. But it's just another way in a large formal body with rules of with Robert's Rules of being recognized. we're a small group and I'll just look and say, do you have a question? And then yes, manager or whatever. But you will see in somebody's that very formal, for what purpose do you rise, member, and then you'll be hopefully recognized.
And we do, I'm sorry, we do tend to pass over. One of the things that we tend to pass over, which is absolutely fine, is the formal notification of certain things like parliamentary inquiries. Every once in a while, somebody say, "Have we voted yet?" and that's technically a parliamentary inquiry. You don't have to say that. That's in my little motions cheat sheet, but don't say.
Yeah. That. Yes, we're not as formal where we would say a parliamentary inquiry, point of order. I would just say, can we do that, or is this?
That's fine. That's absolutely fine. Just say what you think.
Yes, and then there are a few others that you didn't cover that we use sometimes, and I don't have the chart in front of me. If somebody wants to call the question, right, which means they feel like there's been enough discussion, and there may be other items, and then you can have a motion to call the question and end debate on a specific item.
Correct. Yes. And all of those and more are covered in your motion sheet. Yes, ma'am.
Are in the motion sheet. Yes, I thought so. So we don't need to cover every single one, but know that there are some more and that they're in the motion sheet, and they're there for a reason. They're valid, to keep us, on the agenda item that's before us, to keep us focused, to keep us on topic, and for that reason. And so there are some others that you may see people use from time to time, such as, calling the question, for instance. Okay. Any questions, members? No? Well, we will be getting our revised motion sheet, and I'm sure if you have questions, I would say, again, address them to David. If you see something on that motion sheet that you don't understand, or, you want to be able to use and have it before, something like that.
And if there ever is a question on a motion or the status of a motion or which amendment you can always take a pause. If you watch the legislature, if you watch the debates at the legislature, the speaker will
stop,
and the parliamentarian will walk over and they'll compare notes, and so that's done very frequently in big bodies.
And you will see them using some of these other motions too, like calling the question or calling time, and and some of these others. Yeah. Okay. Well, if there are no other questions or comments, and I would, before we adjourn, and remember, this is a 3-part series, so we will have 2 more parts to our to our retreat with a consultant and some other information and activities. But I do want to remind everybody before we adjourn that we have an executive committee meeting and a board of managers meetings a week from tomorrow, next Wednesday, at 4:30 and 5:30 respectively. And so at this time, I'm ready to accept a motion for adjournment. Yes? So Manager Valadez moves adjournment. Manager Brinson seconds that motion. Any discussion? All in favor say aye. Aye. Opposed, same sign. Any abstaining? We are adjourned. Thank you, members. Appreciate it.
Thank you very much, members.
Thank you. Have a great evening.
Thank you, presenters.
Everyone.
Thank you to all our staff and any of the public.
Before, I just want to say I'm glad we're doing this in public, because it educates the public also.
That's why I said any of our public. Yes.
Okay, thank you. Bye.
Good night, everyone.
Thank you. Bye-bye.